So thank you very much for joining me today, Kasper. Would you like to start just by introducing yourself,
Sure.
to me, please?
My name is Kasper Dahl Kristensen. I'm an orthodontist, PhD. I work at a multidisciplinary practice in Stavanger in Norway and at the university in Aarhus, where I'm a guest lecturer and a clinical instructor. I've been an orthodontist for about 10 years. I treat everything from small interceptive treatments to more complex orthognathic surgery cases.
And how long have you been using Spark for?
Well, I've been using Spark for about 2 years, just over. I've been using aligners for about 6 years, starting out quite slow, and then for the last about 3 years, really, picking up the pace and the numbers.
Yeah. And can you tell us a bit about the upcoming course, please?
Yes. This masterclass is intended for orthodontists who would like to gain more confidence in their treatment of malocclusion. So I will try to go through basically everything from how I set up my cases to how I finish them. This will also be on the implementation of these things, so that not only will you learn something about the biomechanics and the choice of attachments, but I will also show you how I implement it and how I use it in my daily life.
And what sort of people would you say the course is most suitable for?
I try to make it interesting for pretty much everybody who has a little experience in using aligners. That means that both orthodontists and with a little experience, but also the more experienced orthodontists will gain something.
So what sort of topics is the course going to cover?
I will explain the biomechanics of different types of tooth movements, and then I'll show you how to use that in patients. And that goes everything from treating patients in the transversal, the sagittal, and the vertical planes of space. And then, of course, how to communicate that to your technicians. So it's fundamental biomechanics with aligners shown in real-life patients.
And what are the learning outcomes from the course? What are people going to take home with them?
Well, I try to do it in two different ways. One is to learning how to move teeth with aligners more confidently. But the second one is also how to implement this on Monday. What are the tools you should do? What are the steps you should do before doing your next Spark submission, next submission of the Spark case, so that you can actually use what you learn. I speak a lot about the patient-centered outcomes and how to make the patient benefit for the treatment, not just for our sakes, but also for the patients.
So what are the benefits of attending this course? Why would you recommend someone to come along?
If you want to be able to treat more patients confidently using aligners, you need tools of both how to move the teeth, but also how to communicate that to your patients. I hope to cover that in my course and make life simpler for both us and the patients.
And lastly, what are you most looking forward to about the course?
I look forward to visiting London again. It's been a while. And I look forward to meeting colleagues from the UK. I always bring something home myself. I try to teach, but the truth is that I learn a lot by doing these courses, both from how I do the presentations, but also from the questions I get from the audience. So I hope that we can do this as a talk, not just me talking, but with questions from the audience as well. By you asking the questions, I know that I answer what you are thinking about, and I get to know what other people are thinking about, and that gets me thinking of how to make my daily life even better.
Well, it all sounds very exciting. Thank you very much for talking to me today.
Pleasure meeting you. Thank you. See you in London.